Ladies and gentlemen, imagine seeing someone you love slowly change before your eyes. Their once lively spirit now fading into a quiet exhaustion. What if I told you these subtle, often overlooked changes are the body's way of silently signaling its final stages? Many of us believe that death in old age comes suddenly, but the truth is, the body gives us quiet warnings, months, even a year before life reaches its end. The challenge, however, is that these signs can be so small at first that we dismiss them as part of normal aging. It's only when we look back that we realize they were there all along. But by then, it's often too late to prepare, too late to make those precious memories count. In this moment, I want to highlight 5 critical signs that indicate your loved one might be approaching their final year. These signs may seem insignificant at first. Perhaps a shift in eating habits, a subtle change in mood, but they are not just random occurrences. They are the body's way of preparing for the inevitable. By recognizing them, you give yourself the precious gift of time to cherish your loved one, to ensure their comfort, and to prepare emotionally for what's ahead. Let's explore these signs together, starting with one that might be easy to miss: significant weight loss. At first, it might just be a belt that needs tightening, a shirt that suddenly hangs a little looser. Perhaps they've stopped eating as much, or their once ravenous appetite has dwindled. It's easy to dismiss this as a part of aging, but unintentional weight loss is rarely a good sign. It indicates the body's struggle to absorb nutrients, a sign that muscles are weakening and vital systems are slowing down. This can increase the risk of falls, weaken the immune system, and leave them more vulnerable to infections. Sometimes, it's not even about what they eat, but how their body can no longer signal hunger properly. This loss of appetite isn't a choice, it's a body trying to prepare for what's next. If the weight continues to drop despite efforts to feed them, it's crucial to understand that this isn't about diet alone. It's about the body's transition. At this stage, comfort and hydration matter more than meals that no longer seem to satisfy. Next, let's talk about fatigue. Not just the kind that comes from a long day, but an all-consuming, deep exhaustion that doesn't go away no matter how much they rest. Simple tasks, like getting out of bed or walking across the room, become daunting. The body is conserving its energy, redirecting it from movement to preservation. Circulation weakens, and muscles no longer receive the oxygen they need. As metabolism slows down, sleep becomes more frequent, and energy drops unexpectedly. This is not just about aging. It's a fundamental shift in how the body is functioning. Many elderly individuals feel frustrated by their inability to do what they once could. They withdraw, not because they don't care, but because they simply don't have the strength. As difficult as it is, pushing them to do more won't help. The best thing you can offer them is understanding, patience, and the comfort of being present without expectations. As mental and physical energy depletes, confusion or withdrawal can become prominent. Someone who was once sharp and engaged may start to forget things: names, dates, places. They may repeat themselves, lose track of time, or become disoriented in familiar surroundings. The brain, like the body, needs oxygen and nutrients to function, and as circulation slows, it becomes more difficult to think clearly. They might experience moments of confusion followed by brief clarity, but these mental shifts can be devastating for loved ones to witness. Along with cognitive decline, emotional withdrawal often follows. Conversations become exhausting, and socializing becomes overwhelming. At this stage, it's essential to meet them where they are, not to push them to engage in ways they can't, but to offer comfort, even in silence. The presence of love and understanding can transcend words. Another critical sign that shouldn't be ignored is frequent infections and slow healing. As the immune system weakens, an elderly person may catch infections more easily and take longer to recover. What once would have been a mild cold or a small scrape now becomes a more significant issue. Antibiotics might seem less effective, and wounds might not heal as quickly as they once did. This isn't just a matter of getting older, it's a sign that the body's ability to fight illness is diminishing. Bed sores, especially in those who are less mobile, become a serious concern. Instead of pushing for more aggressive treatments, the focus may need to shift from curing to comfort. Ensuring hydration, keeping their skin clean, and minimizing stress on the body can help maintain their quality of life. Finally, one of the most noticeable signs that the body is nearing its final stage is changes in breathing and circulation. You may notice their breathing becoming irregular or more shallow. They might pause between breaths, or their breathing might speed up and slow down unpredictably. Cold hands, feet, or even a pale bluish tint to the skin are also signs that the body is conserving blood flow to vital organs. These changes can be startling, and the instinct may be to intervene, to help them breathe more deeply or more steadily. But often this is simply the body's way of slowing down. Your role is to create an environment of comfort, offering reassurance and making them feel safe in their final days. If this message resonated with you, share your thoughts and reflections in the comments. Your experiences matter, and together we can support each other through life's most profound moments. Thank you for being here. As we age, the natural processes of the body slow down, and many people assume that the end of life will come suddenly, without warning. However, the truth is that the body often sends subtle, quiet signals long before death actually occurs. These signs, though they may seem minor or insignificant at first, can offer important clues about the approaching final stage of life. In fact, these early warnings can appear months, sometimes even a year before life reaches its end. Recognizing these signs early provides families with the chance to prepare emotionally, make the most of the remaining time, and ensure that their loved one's last stage of life is as comfortable and peaceful as possible. One of the most critical early indicators that someone is nearing their final year is significant weight loss. At first, this may seem like a minor change. Perhaps their clothes fit a little looser or they start skipping meals. You might notice that their appetite, once strong, begins to fade, or they eat smaller portions. These small changes may easily be attributed to aging, but unintentional weight loss is rarely a positive sign. It is often an indication that the body is no longer able to absorb nutrients properly, and in many cases it signals a deeper, more serious decline. As the body slows down, muscle mass begins to shrink, and the systems responsible for digestion and metabolism struggle to function as they once did. When weight loss occurs, it is often a result of the body's inability to process protein effectively, leading to muscle weakness and atrophy. As muscles weaken, the risk of falls increases, and the immune system becomes compromised. The body is no longer able to fight infections as efficiently, and the person becomes more vulnerable to illness. Additionally, a change in appetite often accompanies weight loss in the final stages of life. As aging causes changes to the senses, many elderly people experience a diminished sense of taste and smell, which makes food less appealing. This lack of appetite is not a simple choice, but a natural shift as the body begins to prepare for the final transition. The brain no longer signals hunger in the same way it did in the past, leading to a decreased desire for food. Underlying medical conditions also play a significant role in weight loss, especially in diseases like cancer, heart failure, or kidney disease. These conditions can be present long before more obvious symptoms appear, and their gradual progression may cause the body to use up its energy reserves more quickly. Even less obvious conditions such as depression or cognitive decline can lead to reduced food intake, further accelerating the decline. In these cases, the body struggles to get the necessary nutrients to maintain itself, which can cause a downward spiral of weakness, exhaustion, and frailty. While it's natural for families to want to help their loved ones eat more by offering their favorite foods or supplementing meals with protein drinks, this may not always be effective in the later stages. If weight loss continues despite these efforts, it's important to understand that this isn't just about diet or a lack of appetite. It's a sign that the body is no longer able to function as it once did. Forcing larger meals or pushing for more food may not reverse the decline and can often cause additional discomfort. Instead, the focus should shift to offering smaller, more comfortable meals, prioritizing hydration, and providing foods that are easy to consume. In this stage, the goal should be to preserve their quality of life, not to force them to eat more than they are able or willing to. Recognizing weight loss as a sign that the body is preparing for its final stages can be difficult for families, as it often feels like an unavoidable sign of aging. However, understanding this sign early can allow families to adjust their approach to caregiving and make the most of the time they have left with their loved one. In these moments, what is most important is not how much someone eats or how much weight they gain, but how comfortable they feel. Instead of focusing on reversing the decline, families can focus on offering comfort, compassion, and ensuring that their loved ones' last months or years are filled with dignity and peace. By recognizing weight loss and other subtle signs as the body's way of preparing for its final stage, families can prepare both emotionally and practically. They can prioritize comfort over intervention, embrace the limited time they have, and make the most of the remaining moments with their loved ones. These early signs allow us the opportunity to create lasting memories, express love, and ensure that those we care for are not caught off guard but are supported in a way that honors their journey. The body's quiet messages can be powerful if we take the time to listen. As the body approaches the final stages of life, One of the most significant and often overlooked changes is a dramatic increase in fatigue and weakness. While it is common for aging individuals to feel tired more easily, there is a distinct difference between ordinary tiredness and the deep, persistent exhaustion that can mark the final months of life. This overwhelming fatigue cannot be relieved by rest and gradually affects even the simplest of daily tasks. It is not simply feeling a little sleepy after a long day. It is an exhausting weariness that pervades every aspect of life, making even basic activities such as getting out of bed, walking across the room, or engaging in conversation feel like monumental efforts. This profound tiredness occurs because, as the body begins to slow down in preparation for the end, energy is conserved and redirected. As vital organs like the heart and lungs function less efficiently, the body starts to prioritize the most critical functions and systems, while diverting less energy to those activities that are less essential for survival. The heart no longer pumps as vigorously, circulation weakens, and muscles receive less oxygen than they used to, resulting in a noticeable decline in strength and stamina. Additionally, the body's metabolism starts to slow down significantly. Typically, metabolism works by converting food into energy to fuel movement and bodily processes. But as the body shifts its focus toward preservation and prepares for its final stage, much of that energy is no longer used for regular physical activity. Instead, it is redirected to support the essential organs, leaving little energy for the activities of daily life. This often leads to an increase in sleep. Many elderly individuals nearing the end of life experience a dramatic need for more rest, often taking longer naps during the day and finding it harder to stay awake for extended periods. This excessive need for sleep is not just about physical exhaustion. It is also a sign of the body conserving its limited resources. For many elderly individuals in their final months or years, it becomes increasingly difficult to remain active or engaged in normal activities. A person who once enjoyed socializing, engaging in hobbies, or taking care of everyday tasks may find themselves withdrawing from these activities due to a lack of energy. The fatigue can create a sense of frustration or embarrassment, especially for someone who once prided themselves on their independence. It can be heartbreaking for families to watch their loved ones become more withdrawn, less involved in life, and unable to do the things they once enjoyed. This deep fatigue often leads to emotional withdrawal as well. A person may stop attending social gatherings, refrain from engaging in conversations, or even avoid spending time with family and friends. This is not due to a lack of interest, but rather because the energy required for interaction and engagement has become too much. The mental effort needed to maintain conversations, to process emotions, or to simply participate in activities is overwhelming. And as a result, many people nearing the end of their life retreat into themselves. From the perspective of the family, it is easy to misinterpret this withdrawal as laziness or unwillingness to engage. The natural instinct is often to encourage the person to push through their exhaustion, to get up and move around, to do things they once enjoyed, or to maintain a certain level of activity. However, this approach can be counterproductive and even harmful. Forcing someone to push through extreme fatigue can lead to additional stress and discomfort, which ultimately contributes to a faster decline. The best course of action is to understand the person's limits, allowing them to rest as much as needed, and to refrain from placing expectations on them to perform tasks or engage in activities that require more energy than they can muster. Instead, the focus should be on creating an environment where the person feels safe, comfortable, and loved. Rather than emphasizing what they can no longer do, families should focus on what remains, celebrating moments of connection, even if they are brief. Conversations, even if they are short, should be cherished. Simple moments of peace and comfort should be prioritized over pushing for activity. Providing an environment that minimizes stress, encourages rest, and supports comfort can go a long way in improving the quality of life for an individual in their final stages. For caregivers and family members, this can be an emotionally challenging period. Watching someone you love become more tired, withdrawn, and less engaged in life is incredibly difficult. It's natural to feel a sense of loss even before death has occurred, as the person seems to retreat from the world. However, it's important to recognize that this isn't something the person can control. It's a natural part of the body's process of slowing down and preparing for its final stages. The fatigue and withdrawal are not personal choices. They are signs that the body is conserving its resources and shifting toward the end of life. Instead of pushing for the person to maintain their previous level of activity, the focus should shift to supporting them through this process with understanding, patience, and love. It's a time to honor their limits, to be present without expecting them to perform or be as they once were. The most important thing at this stage is to ensure that the person feels supported and valued, even if they are no longer able to fully engage with the world around them. The goal is to make their remaining time as peaceful and comfortable as possible, and that begins with recognizing and respecting their need for rest and the emotional distance that often accompanies deep fatigue. As we reflect on the subtle signs that may indicate an elderly loved one is entering their final year, it's clear that these changes are not always immediately apparent, but can offer us critical insights into their health and well-being. Recognizing these signs, whether it's significant weight loss, extreme fatigue, confusion, frequent infections, or changes in breathing, gives us the opportunity to provide better care, create meaningful moments, and ensure that the final stage of life is marked by comfort, dignity, and peace. It's important to remember that aging and decline are natural processes, and while they can be difficult to witness, they also provide us with the chance to cherish every moment we have left with our loved ones. By understanding these changes and responding with empathy, patience, and love, we can make the journey smoother and more peaceful for everyone involved. Thank you for taking the time to watch and listen. We hope this message has helped you recognize the signs in your own life and equipped you with the tools to navigate these precious moments with grace and compassion. Good luck as you walk through these moments with your loved ones, and may you find peace, strength, and support along the way. Thank you once again, and take care.